Hi, everyone. Welcome. My name is Jackson Barnett. I'm a tech reporter here at FedScoop covering defense. Thank you so much for joining me today. I'm joined by two really stellar speakers, Scarlett Swerdlow, a digital services expert and data scientist at the Defense Digital Services, which is a fascinating organization that works on all things digital and all things challenging within the DoD, and Dr. Paul Roysdon, the Chief Solutions Architect for AI and machine learning at Leidos. Thank you guys both for joining me. To start things off, would love to just get a brief check-in on what it is you're working on. Maybe tell me a recent success you've had. Maybe Paul, we can start with you. What's cooking over at Leidos? Tell us what's up.
At Leidos, we're working on a variety of different problems in DoD, IC, health sector, civil sector. Got quite a number of successes in each of those. We are spending quite a bit of time now focusing on trust in AI in each of those different domains. No one particular thing.
Great. Scarlett, over to you.
Sure, yeah, and for folks who aren't familiar with Defense Digital Service, we are a team of technologists who sit in the Office of the Secretary of Defense. And really our mission is to help the department get better at building, buying, and deploying technology within the DoD. We have tended to focus on two types of projects. The first is sort of firefighting, where there's a critical gap, potentially putting lives at risk, and requires a rapid response. And we also work on projects that kind of offer an opportunity to leapfrog the current state of technology within the Department of Defense. Recently, we've been very focused on helping the department respond to COVID. One of our more recent projects actually took place after there was a COVID outbreak on the Teddy Roosevelt at the very beginning of the pandemic. Our team helped stand up in about 48 hours an online tool that sailors could use to report their symptoms each day. And the Naval Hospital on Guam actually used that to triage sailors and respond to the most critical cases first. One of the kind of cool things about that project as a data scientist was that data that was collected through that tool actually ended up being used in an analysis to understand sort of how COVID spread, which was published in the New England Journal of Medicine a few months back.
Very cool, very impressive. And I should also note for the audience that DDS, they're also experts in Star Wars acronyms. Another thing, kind of looking at Scarlett, your background there, you get to point out. To stick with you for a bit here, could you talk about some of the advances and some of the ways that data and digital tools are also being used, maybe broader health applications? What are maybe some projects that you're working on to digitize non-digital data sets and be able to create further outcomes and get deeper insights from data that maybe need a little help from some technologists?
Yeah, absolutely. So yeah, health and responding to COVID is a big focus of ours. And one of the projects we've actually been working on over the last year is with an organization called the Joint Pathology Center. So they sit in the Defense Health Agency. And they have a really important mission within Defense Health, which is anytime a service member or a veteran has a difficult to diagnose disease, their physician will actually send that case to the Joint Pathology Center. And they have a team of specialist pathologists who are able to provide that accurate and fast diagnosis for these kind of particularly difficult cases. And in doing this work, they've actually built up the world's oldest and largest collection of medical data on diseases. When you actually walk into their repository, which sits in Silver Spring, Maryland, it's a bit like walking into the warehouse in Raiders of the Lost Ark, as there are rooms where literally from kind of floor to ceiling are filled with medical specimens. So they have over 55 million glass slides of human tissue samples. They have more than 30 million paraffin blocks that have tissue samples embedded in them. They have scores of boxes of patient and case records. In fact, it was a human lung tissue sample from the Joint Pathology Center that was used to initially sequence the 1918 flu and discover that was an H1N1 influenza virus. So there's been incredible medical kind of breakthroughs that have already happened leveraging this repository. And you sort of, when you're in there, you have the sense that like the next medical breakthrough is somewhere in the walls of this repository. But of course, right now that data is essentially kind of trapped in the repository because it's all in its analog format. It's all in these glass slides and tissue blocks. So we've been working with the Joint Pathology Center to create a pixel pipeline that basically takes these glass slides and transforms them into digital whole slide images that can be stored in the cloud, easily searched, secured, and sort of by de-identification and other methods, organized into disease collections and then shared with researchers. And one of the reasons I like to talk about our work with the Joint Pathology Center is because not only is it an incredibly important mission in and of itself, but I think it's really a microcosm for some of the data challenges that exist across the department. There are treasure troves of data within the department that are either still in their analog format or sort of trapped in legacy systems. And I think we've sort of for too long, treated data as kind of just the byproduct of, some other more important process and kind of more or less discarded it. And, I think what the Joint Pathology Center shows is that if we really want to advance AI in defense, we really have to start with thinking about how do we make data accessible in a way that data is high quality, trustworthy, and easy for people who can use it to access.
Mm-hmm. Yeah, absolutely. Well, if it's a center that has, spans 2 pandemics, it's definitely been around for
Yes.
a while. Paul, tell me what you hear in that example. How do you think that data can be used for advancing health outcomes? Is this a AI solution? Is this maybe just advanced data analytics? What do you hear in that, and what are you thinking about for this example in specific?
Yeah, I think the thing of note here is that over the last several decades, the U.S. government, particularly DoD, has done a great job of building systems that generate lots of data.
Mm-hmm.
Unfortunately, there isn't a great way to deal with the large quantity of data. And furthermore, in order to develop algorithms that work well, data quantity isn't always what's needed. Data quality is often what's needed. And in order to build massive scale systems, you have to leverage both. In some theaters of operation, the quality of the data is imperative. Think safety of life systems. So certainly in the healthcare sector, and Leidos is certainly working in that sector, we want to make sure that decisions are being made for things being administered to patients or decisions being made for patients, that those decisions are being data-driven with good quality data. Certainly there's going to be a quantity of data, but we need to make sure that the quality is good. And it's the same thing on the battlefield. You don't want a combatant commander making a decision on poor quality data, especially when lives are at stake.
Mm-hmm.
One of the things that Leidos is focusing on is trusted AI. And we're using this in a variety of different areas. For example, cyber, AI ops, autonomous systems, for example, autonomous ships, JADC2, another DoD, major DoD project. Airport scanners is another one. Testing, scanning suitcases and bags and that sort of thing, trying to detect objects that should not be on an airplane. These all come back to, in many cases, safety of life systems and making sure that we make the right decisions.
Yeah, absolutely. And for those not familiar with JADC2, that's Joint All-Domain Command and Control, a very fascinating and complex new concept of operation the DoD is working on. Scarlett, I'm curious if there is a DDS angle here. Could you talk about some of the data quality assurances that you work on in regards to battlefield operations, be it with JADC2 or autonomous systems? How are you working to ensure that when literally lives are at stake, the data is of high quality and is being used in quality methodologies?
Yeah, absolutely. And in answering that, absolutely want to emphasize a point that Paul made, which is I think, obviously, you only have to go to like one meeting in the Pentagon or read any of kind of publications that are covering defense to see that there's incredible interest within the department around artificial intelligence and how that can be leveraged, I think, across the enterprise, including in the battle space. But at the same time, there's, I think, a growing recognition in industry that investing in data quality has significantly more return on investment when it comes to kind of the performance of machine learning or artificial intelligence than sort of making comparable time investment in like more advanced or complex or sort of novel methods. But really where we get the bang for the buck is investing in data quality. There was for viewers who kind of follow the data science space, Andrew Ng recently sort of had a talk maybe about a month and a half ago where he talked about this idea of in machine learning operations, we need to kind of shift from the model-centric view that we've had to more of this data-centric view of AI. And there was also a paper that recently came out of Google Research kind of on the exact same topic, and this idea of data quality issues upstream really impact the performance of AI downstream. And this is especially true in sort of high stakes environments. And you really can't think of kind of a higher stakes situation than on the battlefield. Poor performing AI, or these data quality issues not only sort of have the ability to affect the performance of AI, but lives are at risk. And it can also lead to distrust in future AI developments. So I think getting it right in these high stakes environments is really important. And the way we get it right is, one of the ways is through a relentless focus on kind of the quality of data. So that's really the perspective that DDS brings to efforts that, relate to JADC2 or autonomous systems or sort of the questions of AI in warfighting operations is, let's have a relentless focus on kind of good data. And I think when we talk about good data, there's sort of two pieces to that. The first is, just sort of about the quality of the data itself. I'm sure as Paul can attest to as well, there's just sort of questions of, is the data that we've collected that we're now training AI on, is it sort of representative of the conditions where, at the edge where these AI models will be deployed? Have we accurately and consistently labeled this data? A lot of AI in defense is tackling sort of supervised learning problems where the data that we need has to have labels associated with it. Have those labels been generated by subject matter experts who, actually have the expertise, the domain knowledge to do that? Have they been applied consistently? These sorts of questions around data quality are really one important piece of sort of having good data for AI. The other piece that we at DDS advocate for is then also just the kind of going back to the question of just like accessibility of the data. Even if we have great data, if it can't be accessed, that is a lost opportunity. So, we always say that we need to be sort of demanding of the systems that are collecting data, that data be accessible through, APIs that use sort of open, non-proprietary formats and protocols. We need to get better at developing infrastructure that allows for kind of brokering of different data sources, streaming of that data for real-time command and control. We need to just be doing everything we can to like protect the security of our data, but also maximize data sharing across the enterprise. I think one thing we were excited about was actually just this week, I think the department took a really important step forward on this front with Deputy Secretary Dr. Hicks releasing the DoD's 5 data decrees, which kind of get after this these sort of exact capabilities of how do we make sure we're getting data into the hands of data analysts, data scientists, operators within DoD who can leverage it on the battlefield. So data quality, data access, these are going to determine, I think, more than anything else, the performance, the robustness, the trustworthiness of AI systems that we're developing. So that's where we always put our focus at DDS.
I'm glad you brought up the data decrees because I very recently wrote a story about them. So it's a good opportunity to plug FedScoop. So if you haven't read the data decrees, there's a story on FedScoop and there's a link to the actual memo. So I encourage everyone to read that and see kind of where things are going from the very top of leadership and ensuring that data is responsibly and appropriately managed. Paul, over to you on the question of trust. Um, what do you think is some of the most important processes that the DoD needs to go through, both with the people that will be developing AI, but also the people that will be in the field and using AI tools or being at least a part of different AI systems to ensure that they trust the systems that they're working with, and that when that trust is, making sure that trust is robust and calibrated to the right degree, that maybe they're not over trusting it and putting too much reliance on the AI, but not under trusting it and not being able to use the tools and resources to their full capability.
Sure. I think when we talk about AI, we're often talking about automation. And automation, I think, should have multiple components, or really should be scalable. So in the example of, say, an analyst, we may want to use augmentation, so AI as augmentation, to enable the analyst to do work that they currently can't. And I'll give an example of this in a minute. And then from augmentation, maybe there's different levels of augmentation to the point where at the end you have something that's true autonomy. So in the case of an analyst, where they're looking at large quantities of data, a full autonomy would be something where the analyst is essentially removed from the process. Instead of kind of dialing this in or dialing this up or down, the data is being maybe streamed or pulled off of the server and analyzed and producing reports that then decision makers can make decisions on, and through that whole pipeline that everything's trustworthy. In the case of the analysts, one of the biggest issues that we have right now, well, we have a couple of issues. One of them I touched on earlier, which is quantity of data. We've done an amazing job of generating enormous quantities of data, and as we employ other technologies, the volume only increases. I give the example of many of our analysts across the different sectors have so much data that they look at, say, less than 10% of it on a daily basis. So if you get, the example I give is, if I give you 10 pieces of paper and it takes you an entire day to look at one, and then the next day I come to your desk and I give you another 10 pieces of paper with information on them, you haven't gone through the previous 9 from the previous day. You take those, you essentially throw those away, you take the new stack and you start looking through that one. And you only get through that one sheet of paper before I come to your desk the next day with another 10 pieces of paper. That's essentially what's going on. We don't have the ability to sort through the enormous quantities of data, let alone make really good decisions on that data. So some level of autonomy is necessary. If we can, in this case, provide some sort of automation in the process of filtering out all the, say, low quality data or data that's not useful for making good decisions, and focus instead on the high quality data so they can make good decisions, then we've really filtered out a lot of useless information for the analysts to then focus on only the good information. And this is really critical. The other issue is this issue of trust and trusting the algorithms. If you're going to increase this level of autonomy and have some sort of machine making decisions on what data is good and what isn't, the analysts need to understand what those algorithms are, and the algorithms need to be built in such a way that you can interrogate them, so that you can understand whether or not it's making good decisions. And the decision makers also want to understand whether or not those decisions being made are good. So they also want to have some sort of level of ability to interrogate the algorithms. These are I think, areas that the U.S. government right now is certainly focusing on, and there's an increased effort to make sure that we spend more time dealing with both the quantity of data and trusting the information that's being provided. And then some of this issue of trust comes down to education. Many of the people that come in contact with AI or machine learning don't understand what's going on underneath the hood, and not everybody needs to. But certainly there is a subset of folks that do need to understand some of the subtleties of the algorithms, so they understand and can defend, I guess you could say, the decisions that are being made by these algorithms, so that when leadership or some decision maker is asking why a decision was being made by this machine, that they can talk to it and talk to it intelligently.
Yeah, well, I think that's a perfect note to close out on. Trust, incredibly important. So just to reiterate some of the things that I'm taking away from this conversation is the importance of quality data, the importance of quality methodologies to work through that data, to create digital data pipelines that will allow DoD for enhancing outcomes from everything from health to the battlefield, and ensuring once it gets to the battlefield that people can trust what they're working with. So Scarlett, Paul, thank you so much for joining us today. I hope everyone watching learned something like I did, and please enjoy the rest of the sessions.
Thanks.